Greetings, my name is Nurul Hafiza binti Rosli. I'm going to introduce our group case study, left finger abscess. It is interesting how a small thorn can lead to someone being admitted to the ward, as it happened with this patient. She was admitted to the hospital after being pricked by an old palm thorn and presented with swelling and pain over her left finger about 2 weeks ago. These swellings has increased in size, thorn rates, and developed pus over 1 day. Soft tissue inflammation is a common outcome of thorn injuries, and it frequently results in pus formation due to bacterial infections. It is often underestimated how much swelling and severe hematoma can arise from a small thorn phrase. Given the thorn's specific physical characteristics that cause them to penetrate deep soft tissue and bone, all palm thorn injury require a high degree of clinical suspicion and careful management. Not only that, it can be difficult to make a clinical diagnosis of this thorn injury because a plain X-ray film cannot show the thorn pieces because they are radiolucent, but they do aid in detection of changes in bone and joints. The patient's X-ray results show changes in base of the middle phalanx of left finger and the head of proximal phalanx. As a result, this one thorn can cause someone to undergo incision and drainage, including bone crushes over the left ring finger.
This female patient name is Mickey Anna Empathy, and she is 47 years old. She is a housewife and currently staying with her family. She is a Sedaya Prince, and her date of birth is 19 January 1975. Her case got referred by Clinic Kesihatan Selangor. The patient complained that her left ring finger got pricked by the oil palm thorn 2 weeks ago. Then she go to clinic nearby and got the treatment there. She complained that the pain is like a stabbing pain and it did not radiate anywhere. With the pain score 5/10, there is also a pus discharge from her left ring finger. 1 day before admitted to hospital, the patient accepted all treatment given by the clinic or hospital. The patient just worried about the pus discharge from her affected finger. She is unconscious and alert. She got no fever, no medical illness, and no food and drug allergies.
Next, I'm going to talk about disease process of left finger abscess. First, the patient gets pricked by an old palm thorn over the base of the middle phalanx of the left ring finger and the head of the proximal phalanx. The patient claimed that there was no thorn still there, indicating that there was no thorn trapped in the skin. However, once the thorn was removed, the patient created a break in the skin that allowed bacteria to enter the skin. Next, the immune system sends infection-fighting white blood cells to the affected area where bacteria invade the skin. The patient's left finger developed an abscess as a result of the white blood cell attack on the bacteria, which causes some nearby tissue to die and create a hole that later filled with pus. The inflammatory response, which is the pus, contains a mixture of dead tissue, white blood cells, and bacteria. Furthermore, this affected area began to grow, creating a tension under the skin and further inflammation of the surrounding tissues, eventually causing swelling, redness, and fractures over proximal interphalangeal joints (PIPJ). The patient began to feel pain, including limited frictions and tension over PIPJ.
So I will explaining regarding management and outcome. This patient have 3 medication which consists of cloxacillin, paracetamol, and also tramadol. Cloxacillin is an antibiotic which is to fight bacteria infection. Paracetamol works as both analgesic and also antipyretic. And lastly is tramadol, which is an opiate analgesic which is to treat moderate to severe pain. So upon admission, this patient have reported moderate pain, and it is noted as 5/10, and it is greatly reduced to 2. after medication is administered to her. This patient have undergone 2 procedures and 1 surgery, which are incision and drainage and also bone curettage. Incision and drainage is primary treatment for the skin abscess, whereas bone curettage is process of removal of the bone by scraping the bone itself by using a curette. The indication for the incision and drainage consists of 3 components, which are palpable and fluctuant abscess. The abscess is not showing any symptoms of limb despite conservative measure is done, and the size of the abscess is greater than 5 mm. The patient is given regional anesthesia during the procedure. During the procedure, sloughy and unhealthy tissue is debrided and it is removed. Pus discharge is over 2 cc, and for the bone curettage, it is done at proximal interphalangeal joint. It is eroded and the joint is unstable. Lastly, the wound is covered with gelonate dressing and washed with normal saline. Through a surgery, she must be prepared under certain medical condition. First, she needs to fast for 8 hours. This is to prevent risk of aspiration of gastric content. Second, she is under a fluid therapy which normal saline about 2 liters per day is inserted. Third, X-ray imaging, and fourth, informed consent, which the objective of this procedure, the risk of this procedure is clearly explained to her, and verbally and written consent is taken. And lastly, a blood test is taken, which consists of glycated serum albumin, fasting blood sugar, fasting lipid panel, and also glycated hemoglobin. For glycated serum albumin and glycated hemoglobin, this is used to test the mean blood glucose level, whereas fasting lipid panel is used to measure the amount of cholesterol and triglyceride in her body. There were 5 post-operative management were planned for her after she undergo the incision and drainage and bone curettage surgery. First, specimen culture is taken to the lab to further diagnosis. Second, daily dressing is performed every day with hydroxine and also gelonate. Third, current medication is continued, which consists of chlorhexidine, paracetamol, and also tramadol. Fourth, she has been discharged after have been seen by specialists and allowed by the hospital. And lastly, she have given a letter which allow her to do a follow-up for her wound dressing at the nearest clinic. Thank you.
Now, I'm going to talk about her past history. She is 47 years old female and a mother of 3 children. She lives with her family, and the financials are supported by her husband. She is a non-smoker and occasional drinker. She verbalized that she had her history of being pricked by an oil palm 2 weeks ago in the morning, and she claimed that there is no turn left. She has been in pain 2 days ago and pointed it on the left ring finger. Plus, she said that the pain is like a stabbing pain. She also claimed that the pain degenerated anywhere. Besides, the associated symptoms that she noticed was the swelling at the left ring finger is getting bigger. She also claimed that the intensity of pain increased in the past 2 days. She said that the pain is exacerbated when she is trying to move her left hand. She rated the pain score of 5/10. Otherwise, she has no history of chest pain or shortness of breath. Plus, she claimed that she has no history of any cancer, heart failure, hypertension, or stroke. Also, she claimed that the family members have no history of any cancer, heart failure, hypertension, and stroke. Next, the body assessment was done onto the patient. We focused on musculoskeletal system and vascular peripheral system. For the musculoskeletal system, the size and the shape of the left ring finger is abnormal, where there is swelling, pain, and tenderness. Otherwise, the other left fingers and all right fingers are normal and symmetrical. Next, painful and limited range of motion of left finger adduction and left finger abduction. The left thumb is easily moved away from other fingers, and the thumb flexion is 50 degrees, with no pain and limited range of motion. The patient's left finger have poor range of motion. Otherwise, the patient's right finger is able to against resistance with normal range of motion. For the peripheral vascular system, the temperature for the upper limbs is symmetrically warm. It takes less than 2 seconds for capillary refill time on both hands. The pulse rate is regular and in normal range, which is 85 beats per minute. Both radial pulses are regular and beat simultaneously. Next, ulnar pulses are also detected and the rhythm is regular. Plus, both brachial pulses are regular and beat simultaneously. Next, the clinical examination that has been done to the patient was X-ray of left hand. The result shows that there is changes of a base of middle phalanx of left ring finger and head of proximal phalanx.
Now we move on to the next part, which is the nursing care plan for the case study presentation. There has been two nursing care plan that has been outlined for the case study. The first one is acute pain related to left ring finger abscess as evidenced by pains for 5/10 and swelling as verbalized by patient. And the goal that need to be achieved for this patient and the nursing care plan where patient will verbalize reduce in pain with pain score 0/10 within hospitalization. For this diagnosis, the intervention that can be done for the patient is first, we can assess patient's pain using pain score as a baseline data to initiate proper management for the patient. Second, we can reassure patient and guide patient to acknowledge pain to put patient at ease and enable intervention to be performed to the patient. The third one, we can place patient left hand in comfortable position by elevating her left hand with pillow to promote venous return and reduce swelling so it can reduce pain. The fourth one, handle patient's affected hand while doing a procedure such as dressing or inspection to avoid aggravation to the pain. 5. We can administer analgesic and painkillers such as tramadol 50 mg and paracetamol as prescribed by doctor to reduce pain and inhibit the pain. As the sixth intervention, we can monitor patient for any signs and symptoms of medication and evaluate the effectiveness of the intervention that have been done to the patient. For the second diagnosis is the impaired skin integrity related to open wound as evidenced by localized pain, swelling, and skin color changes at left ring finger. And for this diagnosis, we can do an assessment to the etiology of wound by taking note of acute and chronic wound infection, which is the etiology of the wound is very important assessment for a proper intervention and plan to the patient's wound. The second one, we can provide wound care such as wound cleaning and dressing with special requirements and dressing tools such as hydrosin and Gelonate for wound recovery. And the third one, we can perform hand hygiene before having contact with patient to avoid spread of pathogen to the wound site. And we also can instruct patient to avoid rubbing or do anything that can aggravate the wound and pain so that the wound will not worsen. And the fifth one, we can administer antibiotics such as IV cloxacillin for patient with skin infection, which is the IV cloxacillin is effective for the skin infection bacteria to prevent growth and bacteria and also promote wound healing.